Hi everybody. As phlebotomists, we work in a hospital setting. We come across patients, different ages, sizes, from baby to GRHs, like in their 80s, hundreds. I stuck all types of patients, but my tip for babies is if you're on morning rounds and you have a baby to stick, it is best to talk to the nursing staff and see what is the best bet to start off with. If it's good for them if they ask for help to hold the baby down and for them to help you find a vein. That's always good. And what's a good time for them, because babies be sick and parents are already nervous. So it's good to ask them what's a good time to go and wake the baby up so to be stuck. That's the hard thing about it, is you got to stick a baby. But it's you know, for them to get well. But that's the job that we have to do, and it's difficult, to think about that, because you're thinking about your own child, getting stuck and being sick. So that's when the heart comes in and you have the compassion for it. So that means you're going to do better at it. That is the challenge for you, to become better by knowing what to do and how to do it. So when you stick a baby, with their little arms, you just palpate the vein and try to find a good vein, because their veins are positional. They will move around. Some of them have good ones, and some of them are deep. So it's good to use a butterfly, the smallest one. This is a 25 gauge, and attach this syringe to it. Never touch a tube in it, because you could pop that little baby's vein with the suction of a tube. So I wouldn't think that's not good to do. So like I said, you're going to get nervous, you're going to be scared. When I first started studying babies, I was shaking, but I knew there was something in my heart that I know I'm going to do good at, because I want to get it to where I don't want the baby to get restuck. So I'm going to try my hardest to find a good vein and to watch someone who does it on the regular and learn from them. So that's very, very good if you find someone who's good at that, which I did. And it really helped me out in the long run. So find a good nurse